something that everyone's going to look for in a program is it a good quality program? Am I going to get everything that I need to be able to be a good practicing physician or cardiologist? I think MU excels and exceeds all of those attributes. It gives you an excellent education from some of the best teachers, not only in the state, but in the United States. They make sure that your training is tailored to your specific needs, all while giving you every opportunity you have to learn from the patients that you take care of. But really the quality of our program is unmatched from other programs.
What I like to think about our program is that we're preparing them for whatever they want to do. On the other hand, if they're choosing to go on to another advanced fellowship, there isn't a fellow here who's wanted to do that has not gotten accepted somewhere else for an advanced fellowship.
You're going to find that you make your training your own, and I think that's unique here, where if you're interested in advanced imaging, you're going to be able to spend more rotations learning about cardiac MRI, cardiac CT, advanced echo. If you're interested in interventional cardiology, you get to spend more time in the cath lab working on complex interventional cases, chronic total occlusions, working on structural heart disease. We have robotic PCI here. If you're interested in electrophysiology, you can spend more time there. Some people chart their own path in heart failure or intensive care. And I think it's really a unique place where you can develop your own training plan while you're getting all this general cardiology training.
Honestly, the first year of fellowship is difficult. I think it's all across the nation. The first year is usually front-loaded, and in the second and third years you have more electives or opportunities in becoming experts in imaging or intervention. So I think that gives you a good foundation by having a lot of inpatient rotations during your first year. And that way you can also make up your mind about where you want your career to go, and again tailor accordingly in the second and third year. So I feel first year is hectic, but in second and third year it definitely gets much better.
One of the things I really appreciated was how much emphasis and how willing the fellows themselves were to teach the residents and the medical students below them. I think that's one thing that's really important in a program, is really emphasizing that togetherness and that environment for teaching. Being someone who's really interested in academics myself, I'd like to go into that when I'm done with fellowship. I was really able to kind of hone in my own teaching skills over the last couple years as a fellow. And so I think it's really going to help shape me as a future physician in my career long term.
There's such a collegial atmosphere between attending and fellows, such that we're not looked upon as subordinates. We're more so colleagues. The decision-making process that goes into excellent clinical care and patient care, particularly in the CICU where we have our sickest patients, that fosters a sense of growth and personal experience and helps a fellow grow from level to level. And you will find that as a fellow moves from the first year to second year and from second year to third year, more responsibility is bestowed upon you to be able to fly and be able to operate on your own when you do eventually graduate.
We serve 23 counties in terms of a level 1 STEMI center. I think that when you recognize that you're playing a vital role to not just MU Health and Columbia, Missouri, but that you are really reaching out to people who in need from the far reaches of the state, then you realize that there's a tremendous purpose in serving here.
There's everything I would want to see and do to really get trained as a general cardiologist, but at the same time it's not so big that I feel like I get lost in the shuffle, and that's a culture that is hard to come by, where you can be trained in everything you want to get trained in, but at the same time know everyone around the hospital and around the program. So I love that small feel inside of what really is a large, diverse program.